All righty. Welcome, welcome, welcome. Good afternoon, everyone, and thank you for joining us today. My name is Anton Gunn, and I'm an advisor to The Intersection, a Robert Wood Johnson Foundation initiative to provide community to leaders in advocacy and healthcare who are working to dismantle structural racism in healthcare. Now, I've worked in a variety of capacities, including an advocate, a state policymaker, and a chief diversity officer for a large academic health system. So I come to this with not only a great passion and great purpose around building a more equitable, just, and anti-racist healthcare system, but I also have a variety of professional expertise in doing the work. And the intersection is a place to convene, to learn, to share resources, and discuss what organizations are doing to build anti-racist healthcare systems. Connecting with others engaged in this work is crucial, especially during challenging times when resistance is at its highest. And despite these challenges many of you are facing, leaders in healthcare advocacy are finding innovative ways to pivot and sustain progress within these new boundaries. And in many cases, partnerships, those inside and outside of healthcare organizations, are working together to keep these inclusion efforts alive. So we're here today to explore how to navigate the evolving DEI landscape and discover new strategies to keep the work moving forward. Now, before we dive in, I got a couple of housekeeping items that I want to cover. Number one, please add your questions into the chat throughout this discussion. We will record a podcast after today's panel discussion based upon your questions and some of the themes that we come out of this conversation with. So we'll have a better conversation the more you put them into the chat. Now, the second thing I want to make note for you is that I hope that you will stay for the breakouts after the panel. The breakouts are an opportunity to continue this discussion and meet with other people who are doing the work. Now, if you plan to stay for a breakout and you need to be in a room with an ASL interpreter, please send a private chat right now to event support. I'm going to repeat, if you plan to stay for the breakouts and you need to be in a room with an ASL interpreter, please send a private chat right now to event support. All right, y'all ready? Well, then I'm ready. Let's do this. Now, to kick us off, I'd like to introduce Dr. Giridhar Mallya, Senior Policy Officer at the Robert Wood Johnson Foundation, to talk about the state of DEI policy across the country. And so I want to make sure that we get this started right. So I'll turn it over to you, Dr. Mallya.
Thank you so much, Anton. It's great to be with everybody today. I just want to acknowledge, as Anton did, that this is a tough time for equity work and people who are committed to the work of equity. There's a lot of fear, confusion out there, and that's purposeful, that's designed. And I think people also are feeling a loss of support even from within their institutions. And that can feel particularly challenging because you all are the people in those institutions that have been making the case for equity for years and years now. So I want to acknowledge that it is a really tough time, and also say that this work around equity and justice has never been easy. There is always pushback. And for me, what really helps bring some perspective is to look at the long arc of this work. There are people that have come before us, and there will be people who come after us who continue to carry this work forward. And I think that's really important in a moment like this. My hope is to give you some important context and information about the legal and political environment, point you towards some really helpful guidance that's been made available by a number of our partners in the field, and maybe even point to some good news today. Next slide, please. It can be challenging in a media environment like ours, a discourse environment like ours, to really understand what we mean when we're talking about equity in healthcare and public health. Here are the things that I think about. First, it really is about redressing past and ongoing harms of discrimination, racial discrimination and otherwise. Second, it is about creating systems and solutions that provide truly, truly equal opportunities for health. And if we do that, we are going to see gaps based on race and other personal characteristics close over time. Third, and this is a really important point, when we do this work well, it improves health for everybody. This is not zero sum. This is not about some groups losing out so other groups can gain. This is really about creating better health for everybody. And for me, when I define and think about equity in this way, it really does encompass these other very important elements of diversity. How do we make sure our health professions actually reflect the communities that they're serving? Inclusion. Do people feel a real sense of belonging in the places and organizations in which health happens? And then lastly, accessibility. Do people with disabilities get the supports they need to participate fully and bring their full selves and all their brilliance to the work that we do together? Next slide, please. So this environment is complex, and I think what we have seen over the past several years is that there have been state legislative attacks on equity work. We are seeing attacks in the judicial environment through lawsuits and litigation. We, of course, are seeing threats in the public sphere and the court of public opinion in terms of how this work is being talked about and mischaracterized. And now, over the past 2 months, we've seen a whole new front to this set of threats from the federal government. Next slide, please. So there are two particular federal executive orders that I want to call out, which are here. I won't read the titles. The main point I want to make here is that these executive orders define DEI, diversity, equity, inclusion, in very vague, broad, and misleading ways. And that is very intentional, because the purpose of these policies is not just for the policies to be implemented and enforced. It is really to create a chilling effect so that people are fearful to do this work. These two executive orders, as you can see, are interrelated, but they essentially terminate all federal diversity, equity, and inclusion work, policies, programs, employment practices, grants and contracts, regulations. The second executive order also mandates that in federal contracts and grants that recipients need to certify that they don't operate quote unquote illegal diversity, equity, inclusion, and accessibility programs. This is the executive order that does bring in these restrictions even on accessibility work. And lastly, this second executive order also calls for an investigation of private sector organizations, universities, foundations, corporations. Next slide, please. I'll just also say on an executive orders, there are additional ones around making English the official language of the U.S., ones that specifically remove the concept of gender identity from all federal data sets and programming. So there's even more on top of what I showed. But here are some key takeaways. The aims of these attacks on DEI are to set back racial progress and to dismantle key government services and programs. The quote unquote wasteful and illegal DEI work is one of the main reasons being given to cut staff, to cut funding to programs, to really take apart government services and supports that we know are essential for folks in our communities. Second is that this is not zero sum. DEI initiatives, you all know this, have the potential and the power to improve health for all. Third, these executive orders don't change the underlying law around anti-discrimination and civil rights. And most DEI work remains legal, regardless of these executive orders. The type of work that faces the highest legal hurdles are race-exclusive programs, where programs and services are provided only to specific racial or ethnic groups. Now, there are still ways that type of work, especially if it is remediating some very specific discriminatory act, there's still ways for even that type of work to be legal. But outside of that, most of these efforts remain squarely legal. And that's a really important thing to remember. Alongside that, organizations still have many civil rights obligations that they need to meet as it relates to their employees and as it relates to the people that they're serving through their programs. Lastly, and importantly, people and organizations across the country, including I imagine many of you, are fighting back, and there are supports available for this work. Next slide, please. So our foundation, the Robert Wood Johnson Foundation, has been working on these issues of defending racial equity, diversity, and inclusion for close to 2 years now. And you can see the 4 strategies that we are helping to support in the field. We've put $20+ million behind this initiative and have 20 national partners who are working with us on this. Next slide, please. Here are a few key resources that I want to, lawsuits. So there are groups challenging these anti-DEI executive orders right now. Here are 3 of them. You can get a sense of who the plaintiffs are, who the legal counsel are, and what the status is. I'll call out the first lawsuit. That has actually resulted in a temporary injunction. That means the administration cannot enforce that executive order against any entities. That is a huge win. Next slide, please. So here are some key resources. If you want to understand what do these executive orders mean for me and my organization, what do I need to do and not do? Here are 3 that I will point you towards, and we're going to make sure you have access to these, I believe, through the chat and as follow-up from this webinar. Legal supports. If you are an organization operating a racial equity program and you are concerned about whether it could withstand legal challenge, the Lawyers Committee for Civil Rights Under Law can provide you free legal guidance and even representation. And they are one of our key partners. Please reach out to them. Similarly, in the public health space, through Act for Public Health, you can get information and technical assistance, especially if you're a state or local health department on racial equity work. And lastly, 2 great sources of messaging guidance on health and racial equity issues are here. So that's what I've got. I hope I leave you with a sense of hope, even in these very challenging times. I'm going to turn it back to Anton.
Thank you very much, Dr. Mallya, for those great remarks and reminding us all that equity work still remains largely legal. And with that in mind, I want to talk to our panelists, the folks who are doing this work on the ground throughout the country, and that each of them brings a unique perspective and expertise, but are united in the shared commitment to advancing health equity. First and foremost, I want to introduce Kathryn Haines, is the Health Equity Manager at the Virginia Interfaith Center for Public Policy, where she works as a health ambassador, linking faith communities to healthcare resources, and she's a state lobbyist. Also, Dr. Loren Robinson is the Chief Medical Officer and Vice President for Medical Affairs at CHRISTUS St. Michael Health System in Texas, where she leads the hospital's quality and safety efforts and physician recruitment. And Denise Octavia Smith is the founding executive director of the National Association of Community Health Workers. Denise has partnered with a global and U.S. organizations to center community health workers' expertise, racial equity, and authentic community-based partnerships. A big thank you to each of you for joining us today, and I look forward to having an amazing conversation. Now I want to get started with you, Kathryn. Given your expertise in working with individuals with differing views of DEI work, how do you engage with people who would say that they don't support DEI efforts but might have some common ground?
Thank you for that great question. So I would say that they do support DEI initiatives. They just don't know it yet. And I think the biggest reason is because DEI is often used as 3 letters with no explanation, very specific, concrete explanation as to what it means. And so I help them I work to find that common ground together by, one, trying to give some examples of some specific DEI events. And one example is right here on this call, having an ASL interpreter, right? So we could probably agree that if you are having a gathering, and I was on the school board, so sometimes I'll mention, when I was on the school board, if I was going to have a town hall for parents, should we have an ASL interpreter there? Yes, right. But then give another scenario, we have a very small event. We know that nobody has any hearing troubles. Would we have someone who is an ASL interpreter there? No, right? So that's, that is diversity, equity, and inclusion. You provide what is needed in the case to bridge the gap, and you don't provide that thing when it is not needed. I often would offer, again, depending on the person, some incentives for engaging in the work. I might point out that the business community was a very early adopter of DEI efforts, because there is research, and I think probably the most well-known is the work that the Harvard has done, that you think smarter when you work in diverse teams. So obviously, if you think smarter, you have better outcomes, your profit margin is greater, then DEI is a good thing, and helps people understand why we might need to continue to engage in this work. An area that I have had a lot of success, and I mentioned along the lines of ASL, is in the disability community. And that is because while many white people, because it does tend to be white folks that struggle with diversity, equity, and inclusion, might not have a friend of color. And I like to cite the statistic from the Public Religion Research Institute, PRRI. They do a survey, and they did one in 2022, and it found the same information as a survey that was done about 10 years before that. I can't remember exactly. But basically 90% of white folks in the United States have only white friend networks. So it makes sense that it might be harder to use an example from a community of color. But if you use the disability community, I think most white folks know someone, might even have a child. And because I had two of my 4 children did need an IEP and a 504 to succeed in school, I was often active in that community, and so would use examples that they could relate to.
Wow.
And
Well, that's awesome, because again, I think you've laid out this storytelling humanizes issues and helps people to connect to it, illustrate the impact on people's lives. And I think most of us will definitely get it when we can humanize it and put a face or an experience that connects with everyone. Let me go to Dr. Robinson, and I want to bring you into this conversation. So how can healthcare organizations embody DEI principles into their systems and structures so they're a core part of their quality and safety initiatives? That's what you do a lot of. So give us some sense of how you do this inside of an organization. Got to get you off of mute.
There you go.
There you go.
First steps. Thank you so much for that question. I think there's a couple of things. I think, like Kathryn said, sometimes it starts with that anecdote, right? I think you, at the grassroots level, have to help people understand that DEI touches and helps all of us, right? Like rising waters raise all boats. And so when we think about our smaller healthcare organizations, really making sure that it's not just one person's job, it's all of our jobs to work on health equity and think about how this work really makes our work lives richer, but also improves the lives of all of our patients. And I think that's a big piece of it. I'm really lucky, and in my facility, we can say blessed, and that I work for a religious or a Catholic healthcare organization. And so I really like to use the example here of Jesus, which is Jesus embodied health equity, right? His whole thing was the people who don't look like who you think and look like who you think deserve to be treated well should be treated better and best. And so even if we can use something as a simple example of that and help people kind of flip it on his head and think about it differently, that anecdote just opens the door to say, okay, let me at least hear a little bit more about what you have to say. I think beyond that, not everybody is motivated by anecdote, and some folks are completely turned off by anecdote. And so, one of the things that is crucially important is also having data and tying data and making sure that that value proposition hits all sectors. So you have to have data. We know that when you pay attention to health equity, when you advocate for health equity, when you tie data to it and look at outcomes, if you are committed to improving outcomes for these various groups by putting initiatives in place that address the differing needs of your community, your entire community becomes healthier. And we know that from a finance perspective, because it's really important to not only motivate people around core values, but also around value proposition. We know that from the business sector and from the finance sector, that healthier people lead to folks who can contribute more to society, who live happier and healthier lives, and reduce the cost writ large to the healthcare system. And so those are some of the ways that we can kind of embed and inspire and empower people around that. And then make sure that those DEI efforts are part of your risk mitigation strategies. When you look at a hospital harm or you look at a negative outcome, making sure that we tie the conversation around health equity to all that we do and all that everyone does, so that if you did have a diversity officer who happened to find themselves put out the door recently or not so recently, or maybe you didn't have one, that all of you all are picking up that yoke and continuing that work, whether or not Dr. Robinson comes back to work tomorrow. So those are just my opening thoughts.
Well, that's great to hear. And I remember my time in academic medicine. It didn't matter what your job was. Quality and safety was a part of everybody's job, that we had to make sure that the patients were safe and we delivered quality care. So it didn't matter if you worked in a parking lot or if you were delivering patient care directly, it was a part of your job. And what I hear you saying over and over again is the more you embed and integrate diversity, equity, and inclusion into the work of outcomes to get to the point around how patients are healthy and how they're safe, it becomes everybody's job and it's not dependent upon one diversity officer or one person who does the job every day. Great, powerful nugget there. And I think the mic drop moment for me is Jesus was the embodiment of health equity. I'm going to make sure I tell my pastor that when I go to church on Sunday. Now I want to bring in Denise into this conversation. Denise, you got great experience leading a national organization focused on community health. So what should leaders be thinking about as this landscape continues to change? Give us some context of your perspective.
Yeah, thank you so much. Hello to all the panelists and everyone in attendance. Listen, this webinar started with literally my favorite song, Move On Up by Curtis Mayfield. And I'm gonna just sort of stay with that. And I'm just really excited to be here. Listen, the song is about getting a better perspective. Moving on up is about growing into your next, right? It's about leaving where you are to move to a place of thriving, okay? Even when the people around you don't understand. So I want to talk to leaders, each of you in your respective places. And I want to ask you 4 questions. Number 1, who are you leading? Okay, do you have a constituency that you're accountable for? Okay, we have the framing, shifting winds, changing policies, etc. Everything swirling around you and uncertain. Ground yourself in who you're accountable to. How are you ensuring that you have actually listened to the loudest and the quietest voices? Okay, the National Association of Community Health Workers, where I'm the executive director, we have membership in 867 zip codes. Okay, over 4,000 CHWs and promotores and members from indigenous tribes across geography, race, ethnicity, sector, language, and lived experience. So everything we're doing at its heart is affirming, confirming, testing that we are authentic and accountable to our leaders. So number 1, lead with trust. Okay, number 2, why are you leading? Okay, what's your why in this moment? And do you feel it shifting as the winds are shifting, right? Are you letting these temporary circumstances erode your commitment And I know what you're saying because I'm saying it too. This has been a long, hard journey. This is a multi-generational journey we're talking about for diversity, equity, and inclusion, social justice, health equity, as Kathryn said, a lot of different words, okay? But remember where you are in this moment and what you're contributing to this part of this long arc or journey to health equity. So number 2, lead with perspective and value. Number 3, how are you leading? How are you leading in this moment? Does your constituency trust you? Do they understand you? And how do you know that? Okay. How are you leading? Are you contributing to the harm that's in this world? Are you freaking out and making quick decisions, rash decisions that are not grounded in the data that Dr. Loren talked about, in your values? Are you modeling respect and collaboration, a desire to understand? So number 3, lead with empathy and with respect. And then the last one, where are you leading to? And I know that's a tough one in this moment because some of us are trying to figure out where are we, okay? But here are my questions for you all as leaders. Are you strategic? Okay? Do you have a vision that outlives you? In other words, is the goal just to get out of the chaos? I don't care how, we just got to get out of this chaos. We'll partner with anybody. We'll take any money. We'll do anything. Or do you have a long game perspective? So number 4, leaders, and I just love to each and every one of you lead with vision.
Wow. You said some amazing things. I think what really jumped out to me is, are you listening to the loudest and the quietest voices that we hear? Because we know in doing this work, and particularly right now, there are a lot of loud voices in one direction, and there are a lot of people who are trying to find their voice in another space. And so this is for all of you. And I'm actually probably go back to Kathryn here, knowing of your interfaith work and the different constituencies that you're involved in. How can equity leaders, outside of organizations, engage with organizations around this work? And then vice versa, if you are a community partner, how can you engage with a healthcare organization to support the work continuing to move forward, knowing that it's largely legal, knowing that there's so much to be done? Any perspective from any of you about that? And I'll start with Kathryn, and of course, Dr. Robinson, Denise, you can feel free to jump in.
Well, I would say that it is the organization's job to reach out, to figure out what you are missing, and to trust that you will find the answers in your community. And my favorite example from my lived experience is I was on the school board during the pandemic and trying to figure out how to get kids back to school. And we didn't know what the families were dealing with. And there was a lot of talk and theorizing, and do they want to go back or do they not? Will they take the vaccine? Will they not take the vaccine? We'll just go out and knock on doors and find the leaders, and then have a town hall, and ask your questions, because the answers, they really are in the community. And then you avoid, I think some of the, the early on when people were talking about a vaccine mandate without understanding some of the deep vaccine hesitancy, and that you really needed to have trusted messengers. You had to have community health workers. If we had listened to the community first, we would not have gotten ourselves into such a struggle. So first, organizations, we have more resources, reach out. And of course, the faith community, I firmly believe that's where we start, because there is a set of shared values, as Loren already said, right? If your faith is the Christian faith, then you have Jesus as your health equity champion. But you have a set, whether you're Muslim or Hindu or whatever your faith tradition is, you have shared values to really support your community and help your community have the best potential to live to their fullest.
Very good.
they should be at the table.
Very good. So, Dr. Robinson, how are you all engaging community partners the way that Kathryn laid out? Anything you can share there to add us any insight?
Sure, no, absolutely. I think there's a couple of things. I think, when we went through COVID-19, I'm a loud voice. And if you all see me looking down, it's because I'm writing notes as everybody's saying these things because I'm so inspired by this panel. But I think the other piece is that from a large healthcare organization, sometimes we are not where people want to be. And I use that gently. That's my gentle voice speaking. And so as a healthcare administrator, as someone who is a leader who's got that leader in my title, I really want to make sure to educate the people who are kind of on my hallway they work with to say, not everybody thinks that we're great all the time. And we don't have all the answers. And so it's very important for us to go to the community to say, we're not here without you. If you all don't come through our doors, none of us have jobs at all. So really, you all are the experts. And when it comes to us and we talk about interacting with patients, when I talk to providers, I'm really glad that you all have this white coat. But again, you don't have a job if that patient doesn't come through the room. And that patient is any patient who walks through the door, who will be treated with dignity at our facility. But additionally, asking and telling people and empowering them to say, you are the expert about your community. You are the expert about your body. Tell me what you know. Tell me what you have lived. And I will take the piece that I can contribute so we can partner to address what's going on with you as a person. When we talk about communities and health equity, it's equally as important to say, like, we are partners in this. There's not we're the hospital, we're coming down to you. Absolutely not, never. That is never acceptable because it's not ever going to get you. If you think about getting yelled at by a parent, that was never something that was comfortable. And it was never, when you're in your mind thinking, you're not like, I just want to do the thing that they're saying. You're already moved on to that next thing because that's not a partnership. And so when we talk about partnership, it truly has to be that. Nonprofit hospitals are required to do a community health needs assessment where you go specifically outside of your ivory tower and you talk to the communities and the organizations that make up your fabric of your local community to say, what does health and healthcare mean to you? What are we doing well as a healthcare organization? What are we not doing well? Tell us so that we can develop a plan in conjunction with you, not go back to our offices with the doors closed. With you, let's develop a plan for health in our community and think about how we as a large healthcare organization can partner and you as a smaller organization or a non-healthcare organization can partner. And that too is health equity. And I think the other piece of it is this is an interesting time, and I use the word interesting again with my gentle voice. And we're evolving as individuals and as organizations, and grace is so important. I was eating a Cadbury cream egg earlier, and I was looking at that middle part, that caramel part, and that's the fire to me, the fire in the belly. And I want to protest, and I want to raise my loud voice and let everyone know that I'm angry, and how do I show this on the outside? But you equally need people who are in C-suites working on the hard work. You need people who are protesting, doing the hard work. You need people who are continuing to say, I buy products from women entrepreneurs, from LGBTQIA, rainbow flag with the brown and the black on it. Everybody is in this room. And that all of those pieces that we embody and all of the places that we hold is holding space, place, and grace.
Very good. Well, Denise, I'm gonna come to you, but I'm gonna set this scene of an experience. When I worked inside of a hospital, I didn't wear a white coat, but I was one of those leaders that Dr. Robbins talked about in title. And sometimes the pressure can get so difficult inside the box of an organization to move the needle, to continue to move the needle on the work. And one of the things that I found very helpful is to have a community-based partner or a community-based organization that I sometimes can say, hey, it'd be really good if you press these 3 buttons right here, because that will give me the space and the grace in order to be able to move the conversation forward. So give me some context from your perspective as a community partner, what that push and pull might look like from your lens. Again, going to the place of how are you leading? How do you not only lead the streets, but help to lead those of us that we're in the suites that don't necessarily know how to move the envelope sometimes. So give us some sense of that. Denise, that was for you. I need
Is
to
that
get
for
you.
me? Thank you.
Yes,
I
yes,
just wanted to make sure because it was
yes.
such a good conversation. I thought, okay, let it keep going. Yeah, you have y'all have mentioned a couple of words that I think listen, I am a community health worker. So I just want to say I don't want to talk about this as if it's sort of philosophical or
Right.
theoretical. Do you know,
Absolutely.
I am a mother of four. I am a person who's been on WIC. I'm a person who's been on Medicaid. I'm a survivor of a rare chronic disease. I've been homeless. You know what I mean? I've been poor. So
Hmm.
when I think about what I do as a community health worker, it's really about the humility and the love that I have for people. Okay, so I think I just want to say that because for each person it really manifests differently. Some people have not experienced love and safety
Mm.
enough, right, to transform difficult spaces or time into something beautiful. But what Dr. Loren and Anton were just talking about is place, space, and grace, right? How do you know that the quietest voices, people who are marginalized, how do you know they're engaged? Because you're acknowledging where you are, the place where you are. If you don't know the history of where you are, where you're working, if you don't know how that place became the way that it is and how that place in present day impacts health, you're not even really in the place, right? Or what about the space? When we talk about outreach or engagement, a lot of folks like to invite community people to a focus group. That's like the famous take this survey, or how about you take these bus tokens and find your way to the office to the focus group. Well,
Hmm.
what about going to the shelter? What about hitting people up where they are on the street or under the bridge? Right? What about going to where people are? So that really is about spaces. Are you getting out of your space so that you can sit in other people's space? Okay. And then finally is grace. And this is one we need to really hold on to right now because, and I know we're not necessarily talking about this, but we have to be responsible, we in the broader public health ecosystem, for the way in which some of public health is mistrusted and
Mm.
distrusted.
Mm.
What about our language? What about what we did when we had the resources? What about the partnerships we did not resource? What about the stuff we left undone? So the grace now in this moment is that we actually have to listen to some criticism, okay? Not to wound and destroy us, okay? But how does it make us better? And how do we have the grace to actually like listen to that? Okay. And then we don't have to do it alone. Fortunately, there's enough of us with shortcomings to go around because the ecosystem brings health. There's no individual service. There's no individual organization. There's no one piece of research. There's no one study. There's no one anything that brings health and well-being. So we're all are going to sort of share in this just as we're sharing our knowledge right now.
That's so powerful. And just an important context to always read. There's some accountability to be held by all of us, no matter where we are and the role that we play on either side of this conversation. What I like to do is, I want to make sure that we give our audience some tangible pieces that they can take away. So I have two questions I'm going to focus on, but right now I want to start with some people can feel like that they're literally being attacked, and people are being attacked. I mean, Giridhar laid out at the beginning the context of largely it's legal, but there's some things that people are being held off on or held back on. People just trying to find their way at present. So, what I'm really curious about for each of you and your perspectives, what are you doing to remain energized, inspired, or hopeful despite the attacks that might be coming at them? What would you encourage people to do to remain energized, inspired, or hopeful? I just want to give people something that they can really use at present. So I'd love to hear from each of you. What are you doing personally? And then also maybe something that you know is a best practice that everybody could employ. And I'm going to start with you, Denise, and let you go first.
Okay, yeah, let me get really concrete. It's been a crazy couple of months. And even our staff is 100% virtual, right? And we've got members all over the country. So when our members start, well, first of all, we listen to our members because our members are so in community at the hyper local level. They just started letting us know, here it is, right? Here it's coming. The waves are coming. But what we did is we came together. We came together as a staff, the 13 of us, and we just listened. We had moments of crying and anxiousness, right? Uncertainty. We named the uncertainty, but we came together. Nobody was alone in that experience. Then we started creating space for our board, right? See, these are all human beings, and we don't know who voted for who, and we don't know who's experiencing what impact. So we had to come together. We came together and we started wrestling with how are we going to unite under this umbrella of the National Association of CHWs as a collective instead of dissipating, right? And all, sort of retreating and speaking in our own way. So we did a lot of that. But I'll tell you something that I'm very proud of. Our staff members, our board, our membership, we came together in many different settings. And one of the things we agreed is that next week, we're still going to the Capitol and we're still doing our Hill Day, right? And we thought about it. We thought about safety. We thought about effectiveness. We thought about openness. We thought about all the things. And we decided, Stephanie, I see you. We decided we would do it because we're going to celebrate. See, we're not going to prove who we are. And that I want to go back to that when we talk about why are we leading and where are we leading to? We intended our Hill Day to be a moment of celebration. And for anyone who wants to listen and anyone who wants to come to the briefing, we're going to be there. But we didn't do it, you see, for others. We did it for our community to look one another in the eye and celebrate one another. And so I'm really proud of that because it took all the people, right? To make the decision. So we didn't leave anyone behind. And we took time to address some of the concerns, right? And even those who can't make it because of finance or what have you, we're trying to create space and ways for them to contribute.
That's awesome. Oh, so rich there. Dr. Robinson, how about you? What are you doing to remain energized, hopeful, to get through the tough times?
Look, I was about to tell you, Anton, you got 3 moms out here. They moms of 4. Our moms of 3 and trying to get to be moms of 4, but we'll see. But I think that, every day that we wake up is just a gift.
Amen.
And then you take that breath and you walk out of your room and there are people who need you and rely on you. You look at them, you're like, how can I not fight? Look at these people. These people did not ask to be here. Like, I have to fight to make this world what they deserve, because every mama thinks their child is the best thing that ever walked. And so that's my personal kind of first piece. And that's like, okay, let me make this world better. And then you get to work and you're just like, well, how? And, for me, as I hear Denise speak, I'm like, man, I miss my days when I could go to DC, because I was so fired up and inspired by like where I felt like the work was done. But now just knowing and say, like, for me in this season, I can barely go to here in the grocery store, but knowing that people are still fighting, noting that people are still showing up and celebrating to say, we know that this work is our work and we're committed to it, inspires me to continue to say, like, I'm going to keep on keeping on. And I think the other piece is take stock of who you are and where you are and protecting your space and grace, and say, hey, if my organization has said we're stepping away from this, or we're firing all the DEI people, or we're not really sure, so we're still firing the DEI people, that may not be the organization for you, but know that there are organizations out here who are still committed to doing the work, who are still calling it DEI. There are also organizations who are pivoting from the letters DEI because they can't, for whatever reason, use those letters and they've renamed it. And that may be okay for you, and that may be okay for that organization, and that might be a safe space for you to land, or to look to land if where you are is not a safe space, because you have to protect your own heart and mind and your spirit so you can use that energy and go out and fight and choose another day. And so I would say, take your, pull yourself up at home and say, okay, I'm gonna do this another day. And if you wake up and you're having one of those days where you can't, that's okay too. And take a day to say, you know what, today I'm taking a deep breath and I'm going back to sleep and I'll try again tomorrow. Because that's what re-energizes you to go out and fight another day and to continue to be inspired by Kathryn and Denise's example, and you, Anton, and just being here today just really inspires me to go out and do this again.
Fantastic. Thank you for sharing. Kathryn, let's get to you. What are you doing to keep it together, to go to the next level in this work? Share a little bit, please.
So I always have a lot of hope. And I think a couple of things. One, continuing to have the conversations when people feel that resistance against DEI. And I thought of something, I like to use a quick example of a failed effort, because I think people see these check the box efforts, and that's why they're so anti-DEI. And one of the most glaring ones, and I've seen this in a number of places, and one just in my own Catholic church, they put the effort to have signs that would include Braille on the sign, so you could read where you were in the room, etc. But there weren't any bumps. It was flat, right? So and I've seen that in a number of places you cannot imagine. Yeah, no bumps, just flat. That's what you are thinking of when you think DEI, and give them concrete examples, right? Some of the work that I focus on in the health equity space are community health workers. So I love that Denise is on this call. That was divine intervention. And our organization worked with community health workers to win $6.4 million that went to support community health workers and local health districts. And that stayed in the budget this year, sharing the stories and also the data about how they do close gaps, right? And then also in the maternal health space, since I am a mom of 4 and also practice as a midwife, the research shows that if we want to address racial disparities, so that's the health equity piece, right? And maternal morbidity and mortality, then we need to transition the United States to a midwifery model of care, right? We are the only wealthy country that has our numbers flipped. And when I say flipped, in other wealthy countries, midwives catch the majority of the babies, right? Roughly around 80%. And in the United States, obstetricians catch about 80% of the babies, right? So we need to flip our numbers, and then we will close. And we had a number of bills that did pass in this General Assembly, and we will track them and share the outcome, very specific things. And one hospital had temporarily closed its labor and delivery unit in a community where people on Medicaid, where people of color were incredibly impacted. It turns out you had this Virginia code that said that you had to have a pediatrician, a physician with pediatric privileges on call that could be at the hospital within 30 minutes. Well, in rural areas, what if it snows? Even in the best of conditions, right? It might take you an hour to get to the hospital. So the hospital had closed its doors, and a bill passed, and this bill says that midwives can be on call, right? So if a pediatrician can't get to the hospital, you can have the pediatrician available by consult by phone if needed. But the L&D does not close, and moms can still go to the hospital in their community and get the care that they need. So maternal health work closes gaps, and it's my joy.
That's powerful to hear, and so thank you for sharing. Now, I got one more question for each of you, but before we do that, I'm going to pause this conversation for a minute, and we're going to share a poll. So we're going to put a poll on the screen. Please let us know if you plan to stay for the breakout groups after this session. We will end these breakout groups by 2:30 Eastern time. Of course, we hope and want you all to stay and meet and share with peers in the intersection, but having a sense of the crowd is going to help us to plan. So please answer this breakout poll, and also please continue to add your questions for the panelists into the chat. The chat has been on fire, and I love it. So please let us know if you plan to stay for the breakouts. Answer the poll now, and then we will we will go to our final question, if you will, for each of the panelists. And so here's what I want to do, Denise, Loren, and Kathryn. You all are dynamic. You all are well seasoned and experiences. You have seen the ups and the downs and the highs and lows of this work. Y'all have probably seen everything that across the board. And so I want to take you back to the early version of you doing this work. I want to take you back to you just got in to doing health equity work. You just got into DEI work. You've been doing it all of 12 months, okay? And then the world shifts the way it is currently shifted for every one of us, okay? And so you're not as sure and confident and experienced and grounded in the way that you are now based upon your experience to know that ebbs and flows will come, that we will survive and thrive by those of us who stay in the fight. But I want you to speak to that early version of yourself and assume that they're in this chat, that they're listening, that they are in a state, in a rural state or urban state, they're somewhere in America. So what's the number one piece of tangible advice that you would give to the colleague that is you in your younger version of yourself? The physician, the person who's doing faith and community and lobbying and work, the person who's a young community health worker. What piece of advice would you give them? And I'm going to start with you, Denise, and have you go first.
Yeah, I definitely can remember. I'm so blessed to be where I am, and it's because I've had so many allies and mentors, right, that have created space for me to grow into my leadership, to fumble and stumble into it, and I'm still doing that. I would absolutely give them an image of a candle, one lit candle. And I would say, no matter how small that flame is, it still illuminates. It still gives light. We will not solve all. We won't solve all of our patients' problems. We won't solve all of our interpersonal, organizational problems. We won't solve all of the world's problems. We certainly won't do it alone. And it may take beyond our lifetime, but the impact that you can have is still relevant. And if you wake up with that fire, with that desire, and you show up in that way, I guarantee you the next step, you will get to the next step. And you'll be surprised. Sometimes your fire leads you, as Dr. Loren said, to a different organization. Sometimes it leads you to a different approach, right? So be open and be gracious to yourself. But I think we can get up every day, and I think we can do it.
Very good. Awesome.
Love y'all.
Thank you. Hold tight. Dr. Robinson, how about you?
So I would say, so I was looking for an MLK quote, and I need to quote someone other than MLK because we always quote MLK. But I said the words are this still motivates me today, and I didn't know these words then, so we can say I can say it. The time is always right to do what is right. And I think a lot of times when you're in your early career and you're listening to all these people and you see all these examples, it's very easy to feel like you are not enough, or to hear that what you're working on, like, oh, you can worry. I remember being in residency and being surprised that there weren't many doctors or women of color who were attending. So I was like, well, we got to work on our recruitment efforts and how do we recruit and retain. And the advice I got was to stay in my lane and to make sure I did well in my exam, and to just focus on being a student and focus on being a resident, because eventually, like when you get all the way up there, then you can help people. And I felt like that was wrong then, and I still feel like it's wrong now. I'm a little hard-headed because you can lift as you climb. And so if you feel that fire in your belly and you are at the beginning of your career and you're like, you know what, I feel like this is right and I am I want to work on this and I don't know all the people or have all the skills, but I feel like this is where I'm supposed to be. You are where you're supposed to be, and continue to fight that fight and know that we are still here and we are looking for you. We are looking to see who's out there, who's got that glimmer that we can bring with us. And no matter where you are in your space, if you were recently fired and you are on this call, you're in the space that you're supposed to be, and someone is looking at you like you've got this knowledge and this dream and this gift that you can give to someone so that the next time it doesn't happen this way. Because all of us on this call, we're all still working on this work and have somebody who's got us in these spaces. But we didn't have to be. And tomorrow we can wait. The four of us might not have jobs tomorrow. And we might be looking to someone on this call to say, what should I do? And just because we are 10, 15, 20, 30, 50 years into our careers also doesn't mean that we have all the answers. So be inspired for where you are. Know that you can lead from where you are. And also know that good ideas come from everywhere. And you could be very early in your career and have an idea that could save all of this. And DEI is still the right thing to do. So that's my thing.
Amen. Thank you. Kathryn, how about you?
You brought up some memories for me, and I'm going to try not to get emotional here because my moment was actually, I had been in the work for like 10 years, but was always around spaces where everybody was willing to do the work. And it wasn't until I moved back to Virginia that I encountered spaces where people didn't want to do the work, that there was this immediate defensive reaction. And I remember the moment when and I intentionally chose to not be in preaching to the choir spaces anymore, right? And I remember when a friend that I had met recently, who was also a mom of four, so you know, you have four kids, right? It's not, people are always telling you, oh, I could never do that. I'd go crazy if I were you, and you're thinking, if only you knew. I was talking about the racial justice work that I had done, and used the term racial justice. And she looked at me and her face went from besties, we're hanging here, to I'm an enemy. And so we got through it, right? And that really kicked off my work, and we did incredible things. But I would tell the person, that me in 2015,
Okay. Say it.
Kind of what Loren said, right? That you're enough, right? Because the reason that we don't do this work as white people is because it can be really, really hard, right? I know of so many white friends that just decide to not have the conversations because it is hard, and you will alienate folks, and you will lose friends. Sometimes just for a minute. We became, the best of friends. Still friends now. You'll have hard conversations, with your mom, with your dad. It will be very uncomfortable, but you are enough, and you will find incredible allies out there. And we have to do this work because we're stronger together.
Amen. You are enough, and we are stronger together. It's time to transition to breakouts because we could do this all day. I want to thank Kathryn, Loren, and Denise for being here and sharing your insights and your perspective. We hope all of you will stay connected at the intersection and stay connected to the intersection. Please sign up for updates. You can go to meetattheintersection.org. Please follow our LinkedIn page and subscribe to the podcast on Apple, Spotify, or Amazon. And we invite you all to definitely stay for the breakout groups. If you can't stay, we appreciate you exiting promptly so we can know how many breakouts we have and how many participants we have. And we're going to transition to those breakout groups. So thank you again for being here for this episode of The Intersection. Again, thank our panelists. Thank all of you. We will see you on the other side and for the next moment that we have an event. Everybody have a fantastic day.